Okay, listener, let's unpack this. Have you ever been playing, I don't know, just a casual game, maybe trying to snag a frisbee or just running for the bus and suddenly taken a completely awkward step?
Oh, yeah,
That moment where you feel or maybe even hear something you definitely shouldn't.
definitely. It's a common experience.
Yeah, the human body is incredible, but sometimes it reminds us it has its limits, often in slightly, well, embarrassing ways.
Absolutely. And we see athletes push those limits constantly, right? So when things go sideways,
Mm-hmm.
there's this whole complex science dedicated to understanding exactly what happened
Mm-hmm.
and, maybe more importantly, how to fix it and get them back playing.
That's exactly what we're diving into today. You've shared some material that gives us a really solid foundation in sports medicine pathology,
Right.
essentially the nuts and bolts of what happens when sport meets injury. Our mission is to pull out the key insights from these slides you've provided.
Yeah, so you can get a clearer picture of common sports injuries and, how they're managed.
Think of this as getting the inside scoop on the body's resilience.
Mm. And the strategies used to help its remarkable ability to repair itself.
So let's start at the beginning then. When something goes wrong, what actually gets injured? The material breaks it down nicely into three main categories.
Yeah, we're talking about soft tissue, bone, and joint injuries.
Those three pretty much cover the landscape of athletic mishaps, right?
They really do. Covers most of it.
Okay, let's dig into that soft tissue bucket first. The slides mention sprains, strains, and contusions. What's the critical difference somebody needs to know between a sprain and a strain? They sound so similar.
Yeah, they do. But that distinction is really key for understanding the injury. So a sprain involves damage to a ligament.
Okay, ligament.
Think of ligaments as those tough, fibrous bands that connect bones to other bones, often around joints,
Yeah.
providing stability.
Got it. So twisting an ankle awkwardly, that's often a sprain because you're stretching or tearing those ankle ligaments.
Exactly. Exactly right. Now, a strain is different. It's damage to a muscle or the tendon that connects muscle to bone.
Ah, okay.
So like a pulled hamstring or maybe a sore calf after a really hard run. That's typically a muscle strain.
Okay, that makes sense. Sprain for ligaments, bone-to-bone connection. Strain for muscles or tendons, the muscle-to-bone connection.
You got it.
And a contusion. That's just a fancy word for
Okay.
a bruise, right?
Precisely. It's just damage to the small blood vessels in the tissue causing that discoloration. Simple, but definitely counts as a soft tissue injury.
All right, moving beyond the squishy bits to the hard stuff, bones. The material mentions fractures and stress fractures. Now, a fracture is a broken bone, seems straightforward enough.
Usually.
But what's a stress fracture and why is that different?
Right. So a standard fracture is usually the result of a single, significant force breaking your arm in a fall, something like that.
Okay.
A stress fracture, though, is much subtler. It's a tiny crack, or sometimes a series of tiny cracks, that develops over time.
Over time.
Yeah, due to repetitive stress or overuse. Think about the constant pounding on your feet from long-distance running, maybe.
Ah, so one is that sudden snap, the other is damage that kind of builds up. That makes sense.
Exactly.
Okay, finally, joints. The slides mention dislocations and subluxations. What's the picture here?
So a dislocation is when the bones that form a joint are completely forced out of their normal alignment.
Ouch.
Yeah. Think of a shoulder popping entirely out of its socket.
Seen that happen in sports videos. Not pretty.
No. And a subluxation is similar, but it's a partial dislocation. So the bones are moved out of alignment, but they haven't completely separated.
Okay, partial. Still sounds painful.
Oh, definitely. Both can cause significant pain and, importantly, damage to the surrounding structures, like those ligaments we just talked about.
So, listener, think about those categories for a second. Have you ever experienced a sprain, maybe rolled your ankle?
Or maybe heard about an athlete getting a stress fracture.
Right. These terms pop up all the time in sports headlines, and now you know exactly what parts of the body we're talking about.
Right.
Okay, so you've experienced one of these, a sprain, strain, or something worse. What actually happens inside your body the moment that injury occurs and immediately afterward? The slides pivot here to pathophysiology.
Yeah, basically understanding the why and how of the injury process itself.
Right.
And this involves looking at the mechanisms of injury. Was it an acute event? Sudden trauma, like that unexpected twisted ankle landing.
The kind where you know exactly when it happened. That moment.
An exact moment, right. Or was it chronic, Damage that built up over time from repetitive stress, like the runner developing that stress fracture we mentioned.
Okay.
Understanding the mechanism tells us quite a lot about the potential injury type and maybe the severity too.
And immediately, regardless of whether it's acute or chronic, the body kicks off this incredible process called the inflammatory response.
Mm-hmm.
Now, for most of us, inflammation means pain, swelling, redness, heat. It feels bad. Right.
Yeah, it's uncomfortable.
But the slides make it clear this is actually your body's critical first step in healing.
Absolutely. It's like your body's emergency crew rushing to the site. Inflammation is actually necessary to clear away damaged tissue, control any bleeding, and signal other healing cells to come in.
So it's a signal flare, kind of?
Sort of, yeah. While it's uncomfortable, it's the essential launchpad for repair.
So the pain and swelling are actually signs that the repair crew is on the job. That's a good way to think about it.
It is.
And the healing process itself follows phases. The slides list inflammation first, which we just covered. Then comes proliferation. What's happening there?
Proliferation. This is where the body starts actually building new tissue. Cells lay down materials like collagen, which forms a kind of scaffold or framework across the injured area.
Like putting up the basic structure of a new building.
That's a great analogy, yeah.
Okay, so new tissue is being built. And the final phase is remodeling.
Correct. This is the maturation phase. The new tissue that was laid down is now strengthened, organized, and refined. Those collagen fibers align themselves more effectively along the lines of stress.
Getting stronger in the right direction.
Exactly, making the repaired area stronger and more functional. It's the body trying to restore the tissue as close to its original state as possible.
Wow. So the whole journey from injury to potential recovery involves this amazing three-phase biological process. Clear the damage inflammation, build the new stuff proliferation,
Right.
and then strengthen and organize it remodeling. Knowing this really makes you think differently about why healing takes time, doesn't it?
It absolutely does. It's not instantaneous.
All right, so you've got an injury, your body's repair crew is on the scene starting phase 1. But how do the medical professionals figure out exactly what the issue is and how bad it is? The slides move into diagnostic techniques.
Yeah.
And it starts with clinical examination.
This is fundamental. Absolutely step one. It's the doctor or the physical therapist talking to you, taking a history of how the injury occurred, your symptoms.
Gathering the story.
Exactly. And then performing a physical assessment. They'll check your range of motion, test your strength, feel for tenderness, assess stability, things like that.
It's like detective work, right? Gathering clues from what you say and what they can physically observe and test.
That's a perfect way to put it.
Yeah.
And based on that initial assessment, they might need to, well, look inside.
Right.
That's where imaging comes in. X-rays are the classic go-to for bones. They're excellent at revealing fractures, like a clean break in a tibia or something.
Makes sense. And for those soft tissue injuries we talked about earlier, like ligament tears or muscle damage, what do they use then?
That's typically where MRI shines. Magnetic resonance imaging gives these highly detailed pictures of soft tissues. Perfect for seeing the extent of something like, say, an ACL tear in that soccer player case study we might touch on later. Ultrasound can also be useful, particularly for muscles and tendons that are closer to the surface.
So imaging gives them the visual confirmation, basically, to back up what they found in the clinical exam.
Often, yeah. It clarifies things.
And then the slides mention functional testing. What's that about?
Right. So this assesses how well the injured part actually works, how it functions.
Okay.
It might involve tests of strength, power, agility, or stability, often mimicking movements required for their sport or even just daily activities. It helps determine the degree of functional loss and, really importantly, track progress during rehab.
Okay, diagnosis is locked in. Now, how do they actually treat these injuries? The slides outline different treatment modalities, starting with what they call conservative management, and the classic protocol here is RICE.
Ah, yes, RICE, rest, ice, compression, and elevation. It's the standard immediate treatment for so many acute musculoskeletal injuries.
Right, rest seems obvious.
Yeah, rest prevents further damage and allows that healing process, that inflammation phase, to begin properly. Basically, stop using the injured thing.
Stop poking the bear.
Exactly. Ice helps reduce pain and swelling by constricting blood vessels. Compression, often with like an elastic bandage, also helps control swelling and provide some support. And elevation, just keeping the injured area up above the heart level, uses gravity to help drain excess fluid.
So RACE is all about managing those immediate symptoms, the swelling, the pain, and creating a good environment for that initial inflammatory phase to do its job.
Pretty much, yeah. It's first aid for these kinds of injuries.
The slides also mention pharmacological treatments like NSAIDs and pain relievers, ibuprofen, things like that.
Right. And these are primarily for symptom management, again, reducing pain and inflammation. This often makes a person more comfortable, but crucially, it can allow them to participate more effectively in rehabilitation exercises later on.
Ah, okay. So it's not just about comfort, it enables the next step.
Sometimes, yes. But it's really important to remember, these medications don't fix the underlying tissue damage itself. They manage the side effects.
Good point. And sometimes, despite RICE and meds, the injury is just too severe for conservative methods alone. The slides touch on surgical interventions. When does it get to that point?
Surgery is typically considered when the injury is severe and unlikely to heal properly on its own, or if that conservative treatment we just talked about has failed.
Okay.
Examples might include complete ligament tears, like a totally torn ACL, certain complex fractures that won't line up right, or maybe significant cartilage damage inside a joint.
And the specific procedure?
Oh, that, of course, depends entirely on the specific injury being repaired. Lots of different techniques.
So diagnosis done, initial treatment underway, but for athletes or really anyone who wants to get back to their previous activity level, that's definitely not the end of the story.
Not even close.
The slides rightly emphasize rehabilitation and recovery as absolutely crucial.
Yeah, this is where the hard work really happens. Rehabilitation is an active, structured process, and it usually involves different phases.
Phases, okay.
It typically starts with protecting the injury and managing pain and swelling. Then it progresses through restoring range of motion, building back strength, improving balance and coordination, and finally getting back that sport-specific or activity-specific function.
And physical therapy is key here, right? Those PTs are like the guides through this whole journey.
Absolutely critical. Physical therapists design specific exercise programs and use various techniques to help the body regain function safely and effectively.
They're sort of stress testing the healing tissue in a controlled way.
That's a good way to think about it. They ensure the healing tissue is stressed appropriately, not too much, not too little, to promote strengthening in that remodeling phase we talked about.
Right, getting those fibers aligned.
Exactly. And preventing stiffness, restoring normal movement patterns. It's very tailored specifically to the individual and their particular injury.
And the ultimate goal, the slides mention, is reaching specific return to play criteria. This isn't just about feeling better, is it?
No, not at all. It's a set of objective benchmarks. Things like strength tests compared to the uninjured side, functional assessments like jumping or cutting, and sometimes even psychological readiness.
Ah, the mental side too.
Definitely. The athlete has to meet these criteria before being cleared to safely compete again.
Because rushing back too soon is a huge risk.
One of the biggest risk factors for re-injury, yeah. The criteria are there to minimize that risk and ensure the athlete's body is truly prepared for the demands of their sport.
Which leads us perfectly into the next point from the slides. Injury prevention strategies. Because, the best injury is the one that never happens in the first place.
Couldn't agree more. And some simple steps can make a big difference, like proper warm-up and cool-down exercises. They seem basic, but they're vital.
Why exactly?
Well, warming up prepares muscles for activity, increasing blood flow and flexibility, making them less susceptible to strain. Cooling down helps with recovery and maintaining range of motion afterward.
Like you said earlier, it's like getting your car engine ready on a cold day. You wouldn't just redline it immediately.
Exactly that. And beyond the immediate pre- and post-activity stuff, strength and conditioning programs are fundamental.
Right, the year-round training.
Yeah. Building overall strength, stability, core strength, flexibility through consistent training makes the body much more resilient to the forces encountered during sport.
And don't forget protective equipment. The slides mention it too.
Crucial. Using things like helmets, pads, appropriate footwear for the surface, or even braces where necessary can significantly reduce the risk or severity of certain injuries. Think impact absorption or joint support.
It's about layering that prevention, isn't it? From preparing the body itself to using external protection.
Precisely. A multifaceted approach.
Now, the slides also mention the value of looking at case studies, and they even list specific examples, things like an ACL tear in a soccer player, a rotator cuff injury in a swimmer, a stress fracture in a runner, tennis elbow in a tennis player, and even a concussion in a football player.
Right. And these real-world, or at least realistic examples, really bring all the concepts we've discussed today together, don't they?
Yeah, how so?
Well, they show how the mechanism of injury varies, like an acute ACL tear from a sudden pivot versus chronic overuse tennis elbow.
Okay.
They show how different diagnostic tools might be needed, maybe an MRI for that ACL versus primarily a clinical exam and history for the tennis elbow.
Right. Different tools for different jobs.
Exactly. And how treatment approaches differ, potential surgery for a complete ACL tear versus conservative rehab, maybe injections for the tennis elbow, and of course how the whole rehab journey is unique for each injury type and athlete.
So looking at these specific cases helps illustrate that while the general principles of, say, healing, diagnosis, and treatment apply across the board,
The specifics are always tailored. Tailored to the individual injury, the person, and the demands of their sport or activity.
you got it. It really highlights both the science and maybe a bit of the art involved in sports medicine.
So we've taken a pretty deep dive into sports medicine pathology based on the material you shared. We've explored the different types of injuries, soft tissue, bone, and joint, and hopefully clarified the difference between things like sprains and strains or acute versus chronic injuries.
And we've seen how the body responds with that initial inflammation and then progresses through those fascinating phases of healing, proliferation, and remodeling.
Yeah, that repair crew analogy.
Yeah.
We know how the experts use a mix of clinical detective work, imaging like X-rays and MRIs, and functional testing to figure out exactly what's wrong.
And we've covered the different ways they can treat injuries and, when needed, surgery. But most importantly, I think, we understand that getting back isn't just about fixing the initial problem. It's about that dedicated, sometimes long work of rehabilitation and meeting those crucial return-to-play criteria to help prevent re-injury.
Which is the goal, really.
Yeah.
Sustainable return.
And that prevention is such a key piece of the puzzle, whether it's warming up properly, hitting the weight room consistently, or just wearing the right gear.
Definitely.
Understanding all this stuff, I think it gives you a whole new appreciation for what athletes go through when they get injured and all the science supporting their recovery.
It really does underscore the incredible complexity and, honestly, the resilience of the human body under stress. It's pretty amazing.
It is. So thinking about that whole complex journey from the moment of injury through those biological healing phases and the entire rehabilitation process, does this maybe change how you think about an athlete's recovery timeline? Is it just about the physical clock ticking, or is there something much more layered in those return-to-play criteria that factors in all these stages, the remodeling, the functional testing, even the mental side we touched on?
That's a great question to ponder.